Hello, my name is Claudia Serrato, and I'm here to present my research. So I would like to first introduce my introduction here. Um, as we know it, COVID-19 has altered the way we learn, buy groceries, socialize, whatnot. So I wanted to highlight this here in the introduction. Just a few key things. The words quarantine, lockdown might invoke some apprehension in certain people or individuals. And what we have experienced is that society has had a hard time navigating critical health and medical resources given the due to just the amount of information that is out there, whether it's right or wrong, and the innovation of many industries such as biology, computer science, medicine has helped us better respond to public health crises. However, it's not we have not addressed the gap between how to better distribute information to the public here. So I first wanted to talk about in my literature review is what is an epidemiological investigation. I started with like defining what it is and just few terms there that happen. And as we go down more, we'll see the more complexity in this information and see how it could be very maybe confusing for the public to understand this information. So I have here that margarine, just because there is margarine, the sales of margarine and um, and the divorce rate in Maine doesn't mean that you should throw out this key like item right here for your food or for consumption. It just means that those things just align graphically. That correlation does not mean causation, and in statistics, as we know. And as we go further down here, I have epidemiological methods that I did in my lit review. Just to see the complexity of information. Um, so here, this is just a standard model that's used for diseases that we know for a while, such as meningitis, chlamydia, smallpox, etc. So in my materials and methods, I used journal articles from the National Library of Medicine, such as PubMed, National Science Foundation, or whatnot. Again, I use keywords, and in my results here, um, I really, I really saw and concluded that really we need to address social determinants because COVID-19 really put a spotlight to social determinants that have been here for years, really decades. And what a great way to do this is to um, welcome, to better include people of different backgrounds, of different spaces into the scientific, into the medical healthcare community, whether that be more people in the dissemination of information in public health or people doing research, people being biologists or whatnot, all that is key to, to better understanding. And furthermore, um, again, what I concluded was that in biomedical research, there actually is over reliance on mathematical models that we've seen earlier, like those epidemiological models. In, uh, inaccurate data interpretations, again, that correlation causation. So if we can have people from different backgrounds of addressing not only this better need to do better research or to have better methods, right, evidence-based methods here, um, but also for them to also have an input in how to share this information to the public health once we first, get the right information. That is key. I was able to shadow a hospital actually in early January, and really it was awesome because I talked to a family medicine doctor, I talked to physical therapy, speech pathology, and all of them had really the same thing. The really drive is we need to better really understand people from different backgrounds, even if you aren't from a similar background, to have a better education, to better talk to them, have the right words to talk to them, to distribute that information right. And additionally, I do not want to forget here, as I conclude real quick, one thing about Governor State University. We are a smaller university. However, we did have two alumni who did contribute to the creation of one of the COVID-19 vaccines. So again, smaller university who welcomes all people of different backgrounds or whatnot. We are addressing social determinants as well too. Have a great day.